Hi everyone, Dr. Hall here, continuing on with lecture 10. So now we're going to talk about cosmetic surgery of the breasts. So breast augmentation surgery, otherwise known as implants, right? So here's the thing. We've created this aesthetic or this expectation of the ideal or sexy woman as someone who is very thin, very low body fat, but then has large breasts. As you know, the main determinant of breast size and shape is the amount and distribution of adipose tissue or fat. So we've created an aesthetic that's almost impossible to achieve, and it is impossible to achieve for about 98% of female-bodied people are actually physiologically unable to be very thin and yet have large breasts. So since it's not possible, then breast implants have become really popular, right? So there's no shortage of before and after pictures out there, and you can decide which you think is more attractive or sexier or more beautiful, right? But because we do tend to, as a culture, elevate large breasts as a sign of attractiveness, right? There are a lot of people who are very interested in getting their breasts enlarged surgically through implants. So there's no shortage of examples, as I said. Now, of course, when you do this, you want to be sure that you don't go too big too quickly, or you can get stretch marks on the skin. And so this has become really popular over the last several decades. So the number of breast augmentation surgeries performed per year is now about 300,000 a year. And so this has tripled since 1997. So you can see it was down around 100 back then. So huge explosive growth in this surgery. And it is now the #1 most performed cosmetic surgery in the country by far. Here's data from the American Society of Plastic Surgeons. This is their report on 2019 data. It's an alphabetical listing, not in listing by most popular, but you can see that breast augmentation is #1. And not just because it's alphabetical, so about 299,715 in 2019. And you can see it's about 100,000 more than in 2000. So these numbers have been going up for the last 3 to 4 decades for sure. I want to just also point out to you that the second line on there is breast implant removals at 34,000 almost in 2019. Then you might wonder, what's that one that's about 265,000 down at the bottom that kind of got cut off? That's liposuction. So that's #2, right? Getting excess fat removed. That's #2. So a lot of people say this is ridiculous. Your body is beautiful. You should celebrate your body the way it is. There's no need to undergo unnecessary surgeries to make your body look differently, and maybe, try to love the body that you have. I think that's wonderful, right? Bodies come in all shapes and sizes, and they're amazing. And there are some people that are extremely unhappy with their bodies. So the question becomes, when, if ever, would it be appropriate or worth the risks, right? Worth the known risks as well as the financial costs to do a surgery to change the way your body appears. So we'll look into just some of the factors to consider. So one is the psychology of it. So before too long, they realized that people who'd had breast implants actually had higher suicide rates than female-bodied people who didn't have breast implants. And so there was a lot of concern there that, oh my gosh, right, there's something about having this surgery that makes you even less satisfied with your life and increases your risk for depression and suicidality. But on closer examination, they found that in general, people who choose breast implants already at baseline have a higher risk of depression and suicidality. So in fact, it appears not that what we're seeing is that getting breast implants is bad for you, right? It appears that people who choose breast implants tend to have worse mental health at baseline than people who don't. And that would kind of fit with a lot of what we've come to expect, right? So if you have a very healthy self-esteem, you're very happy with your body, you are less likely to be depressed. You are also less likely to choose surgery. But what's really interesting is when you talk to people who do choose breast implants, the vast majority of them actually report significant improvement in their well-being. So their overall health and satisfaction does improve after surgery. So that's something we need to pay attention to. So we're going to talk a little bit about the risks of this surgery. And so before we do, I just want you to know a little bit about the different types of implants that are out there. So one of the most common is silicone. I think I have one. Let me grab it. So silicone implants are these little kind of silicone, here we go, silicone capsules that are filled with a gel. So I don't know if you can see, this is kind of squishy, right? It's gel. It's very kind of cohesive. It's, it's like thicker than honey. I don't know what I would say it's like. Okay. So this is silicone. It gives a good cosmetic result. It ends up looking fairly natural. It doesn't feel totally natural, but it ends up looking pretty natural, as long as you're kind of within the limits of normal size and physiology. There is some concern that if these rupture and break open, which can happen over time, that the silicone gets out into your body and could potentially be toxic. So there have been some studies done. However, they haven't been very long-term studies. So we have some studies that go out and follow people out 1 and 2 or sometimes even 3 years, and they say, no, this is totally safe. And that's the data on which the FDA approved silicone implants. The tricky thing is, this is something that's going to stay in somebody's body for 5, 10, 15, 30, 50 years. And so we don't have long-term studies looking at the safety of silicone implants. And there are some people that feel quite strongly that their health has been harmed by ruptured or leaking silicone implants. The jury is kind of still out on that. So the other option is saline, which is salt water. And that might seem weird, but actually, like, the water in your blood is salt water. We are kind of saltwater-based organisms inside. And so that's entirely harmless, because if it pops, then it just gets absorbed by your body and is totally fine. In fact, we give saline through an IV to people when they're dehydrated, right? So that's totally safe. But it gives you a little bit less of a good cosmetic result. It can kind of get waves and things in it. And if it does rupture, it kind of pops and deflates all at once. So some people are not as excited about that. There's some other types of materials that they're looking at putting inside these shells, like soybean oil and polypropylene string, all kinds of different things. Those are much less common. And then they're also trying to perfect doing fat grafts, where they take adipose tissue from other parts of your body and then basically inject it into the breast. That's technically difficult to do, and so it's still not commonly performed. So those are the basic different types that are out there. You might also be wondering exactly, where do these implants go? Well, one this size is not going to fit in me, but anyway, normally what they do is they make an incision underneath the breast, and then they slide the implant up behind the breast that's already there. So you can see in this image in the left, you can see it's sitting on top of the chest wall muscle, the pec major muscle, in between the muscle and the breast, and then that kind of pushes the breast outward more. Sometimes they'll do it under the muscle, but as you can imagine, that might cause some problems using the muscle and is a little bit more difficult surgically. So over the muscle is the most common. And so the only incision that they make is just a little tiny incision underneath the breast that's usually hidden quite well in the fold of skin there. So there's a lot of risks. So anytime you have surgery, there are risks. Even if it's a minor surgery like getting your appendix out, there are risks. So there are risks associated with the anesthesia itself. You could have a bad reaction, which in rare cases can even be fatal. You might have excessive bleeding that requires blood transfusions. You could have damage to the nerves because anytime they cut something to do a surgery, sometimes they cut some of the nerves and you could end up with some numb areas. Also, anytime we make an opening in the skin, there's a risk that you might get an infection there, right? Just like the cut can get infected. Anytime you have surgery, you're probably going to have a scar, right? So these scars, they try to hide underneath those natural folds of skin. Surgery hurts. Loss of sensation, again, related to nerve damage. And then bad cosmesis. So what is that? Bad cosmesis means sometimes it just doesn't end up looking good, right? Sometimes it doesn't end up looking the way you wanted it to look, or it's too big, or it's too small, or it's a little bit off to the side, right? So sometimes you don't get the cosmetic result you wanted. There are also some future breast problems that can occur, such as difficulties with breastfeeding. So for the most part, they're not really interrupting a lot of those mammary glands, lactiferous ducts, lactiferous sinuses, because they're just kind of sliding in behind it. But sometimes that can end up disrupting some of those structures. Even more likely is that because it changes the contour and the consistency of the breast, it can make it harder for the infant to latch on and nurse properly. It also can create difficulty with breast exams and mammography down the line. I can definitely tell you it is much harder to examine the breast of somebody who has implants because most of what you just feel is the implant and it's pretty firm, and so it's tricky. Then there are problems related to the implants themselves. So again, remember I said these are going to stay in somebody's body for potentially 50 or even 60 years, depending on how old they are when they get them and how long they live. And so one thing that can happen is that you can get scarring that kind of pulls the implant in a certain direction. So I'll show you what that looks like. Here's an example of that. So this person, the image on our right, which is her left, is kind of what things looked like to begin with. And then we see on the other side where the breast almost looks kind of tubular and coming out at us. That is because the implant got pulled in a funny way by scar tissue. There's also this potential for leakage, right? And so we talked about, we're not really sure whether silicone is potentially toxic or not. So far, the data doesn't support that it is, but it's pretty short-term data, so it's hard to say. And the FDA actually now recommends that if you have silicone implants, you should have an MRI done every 2 to 3 years to make sure they're not leaking. And then if they are leaking, you need to get them out and replaced. There's also a rare type of cancer that has now been associated with silicone implants. It's really, really rare, but it can occur. I think the most important statistic for you to keep in mind is that because of these problems that can develop, about 20% of people who get breast implants, so 1 in 5, end up having them removed and maybe replaced with new ones or maybe removed altogether within 10 years due to complications. The cost for that second surgery is almost as expensive as the first surgery, right? So again, plastic surgeons did 34,000 removals in 2019. So that's just something to be prepared for. If you're thinking about choosing implants, there's a pretty high likelihood that you're going to need to get them taken out at some time with all the additional risks and costs associated with another surgery. So there is a really interesting documentary called Absolutely Safe. The filmmakers definitely have a bias. It will become very readily apparent to you that I do think at times gets in the way of the veracity of their reporting, but it's very interesting. And so that's an opportunity for you. On the flip side, sometimes people have really, really large breasts. And so some people might say, oh, that would be amazing. I would love to have really large breasts. I have these really small ones or whatever it might be. But actually, really large breasts are also problematic. It can be really, really difficult to find clothing that fits, for the one thing. And then the other is you have all this weight hanging off the front of your chest that's kind of being supported by your bra straps, which can cause a lot of shoulder and back and upper neck pain, right? Just all this extra weight sitting on the front of your chest to make it really hard to keep your posture. It's just a lot of extra weight to be carrying around. It also can limit your ability to be physically active, right? Because they're big and they're bouncy and they get in the way, and it's hard to find a good sports bra. So having very, very large breasts can also be problematic. So the surgery to do a breast reduction is called reduction mammoplasty. Mammoplasty just means plastic surgery on the mammaries, right? So on the breasts. And this one's tricky because it's not usually covered by health insurance, even though there are some really good legitimate health reasons to have it performed. It is usually not covered by health insurance. All right. So in summary, we talked about breast augmentation surgery, which is implants. They're really common because we've set up this expectation for a skinny body with large breasts, which is physiologically impossible for the vast majority of female-bodied people. There are different types of implants, silicone and saline being the most common, and patients who choose them do report improved quality of life afterward, but there are also significant risks. So the surgical ones, the cosmetic ones, risks for breastfeeding and mammograms later in life, and overall 20% get removed within 10 years. So probably even more than that get removed before the person's lifetime is over. And then the flip side would be reduction mammoplasty or breast reduction surgery, which often does a lot to improve somebody's overall physical health, but is also usually not covered by insurance. All right, so 10C, we'll talk about breast physiology, how they actually work.